our job is kind of two jobs at once. So we are here to treat, so we actually are working as physical therapists, working with patients, but also a major component of what we're doing here is training. So we are bringing functional manual therapy to the, we have 8 wonderful staff members from here that are from India that are learning our methodology, or I should say Greg and Vicky's methodology of functional manual therapy, so that our job is not only to be mentoring them and to bringing this new skill set to them, but also as it would be if we were still working in the United States, that we're treating patients on a one-on-one type of a basis. So we have 2 major roles.
We've seen one person after another who's come in with a shoulder injury, a hip injury, a back injury, who've had physiotherapy. In some cases, we've been told that they felt they went to the better physiotherapists here in Delhi, and they maybe got 50% better, and then that was it, or they got only 20% better, and they went for dozens of treatments, and then we're told, well, you just have to live with it. And we've applied the functional manual therapy technique, and to a person, they've all gotten better. I mean, people who've had problems they've been living with for 10 years, 3 FMT treatments, 4 FMT treatments, and they're 90% better or 100% better. And so I guess that's a kind of a general way of saying what we're bringing is a skill level that from my understanding, doesn't currently exist here. And we've had some wonderful opportunities to make changes in people's lives.
Our sessions are between 45 minutes and 60 minutes. One of our major strengths is that we don't just ask you, oh, your elbow hurts? Okay, well, let me go get a hot pack for your elbow. I want to know everything about how your elbow started hurting. When was the first time you felt it? Do you have any other pains? I want to then stop and have a look at your whole body to see whether or not, well, is there something down very far away from your elbow that could be relating to that pain or causing that pain? So the beginning of our session is going to be subjective, which is just simply question and answer time, so I can really start to understand your pain and your injury and how it affects your life and what your goals are, what you'd like from me. And then it's going to be what we call the objective session, which is where I start to make my decisions about what I see that could be mechanically or neuromuscularly wrong with your system at this point, and then I can decide how my treatment phase, which is of course what comes next, the treatment phase will be based on what I find objectively. I would say absolutely any time. I would love to have people come in, at the first inkling that something may be wrong, or that, because if you wait and it becomes worse and more chronic, then it's that much harder to, we'll still make you feel better, of course, but it's that much harder to make the improvements. The longer chronicity, the longer lasting somebody's pain is, then I would say as a general rule, frequently the longer their recovery is.
No, but often it's also more complex, using the analogy that I used earlier of someone who had an ankle injury. And what usually happens is the pain of the ankle goes away and they think it's better, but in fact it isn't quite normal, and then they develop a compensation pattern that ultimately results in their hip pain or their back pain. And so the longer something has gone on, the more, not always, but sometimes the more complex it is. You have compensation patterns that exist in the body. And so it's not just now one region, it's more involved. In a case of someone who's been living in some significant amount of pain or had some limit to their life, if you went to that person and said, what would it be worth to you to not have this pain? How much would you pay? In many cases, people would say, how much do you want? I mean, we've seen just in the few times, there's one case that comes to mind of a man who had to have some surgery on his brain, and then there was still some tissue growing, and they used some sort of a laser to burn it. I'm not clear exactly, but he ended up with this massive amount of scar tissue, and then as a result of the laser to burn the excess tissue, had facial palsy so that he couldn't close his eye. So for 10 years, he's been taping his eye closed every night and having to use artificial drops because his eye wouldn't tear. And after just, I think, 2 or 3 sessions, he was able to sleep without taking pain medication, without using tape to tape his eye closed, and he now has his own tears back, and his eye is lubricating itself, and he's not, this man has been living with us for 10 years, 3 sessions, and he still has some facial paralysis, but he's gotten something that's very valuable to him. One of our greatest examples of that is that when we first started, we weren't fully booked so that all our therapists were having patients all day long, and people would get up off the table and make their next appointment and then say, "Can I bring my mother? Can I bring my father? Can I bring my husband? Can I bring my brother?" And so they would show up, and sometimes people wouldn't even ask. They would just show up at their next appointment with their family member with them, even if we didn't have space for them. So that's been the response.